start us off, and then perhaps Ian can join us. I'm sure he will, and I can perhaps just hand over to him when he comes. So just wanted to start by welcoming everybody today. We've got quite a large number of people, which is fantastic, and I wanted to begin by acknowledging the traditional custodians of the various lands on which we are living and working from today, to pay my respects to elders past and present and emerging, and recognise the diversity of Aboriginal and Torres Strait Islanders peoples and their ongoing cultures, connections to the lands and water. And I'd also like to acknowledge all Aboriginal and Torres Strait Islander people present today. I'm on the Gadigal, the lands of the Gadigal people of the Great Eora Nation, and I guess that everybody will be in a different place. So acknowledging all of those owners. So I'd like to extend a special welcome to two organisations that have recently become members of the Institute. Macquarie University Centre for the Health Economy at Macquarie University, welcome. It's great to have you. And the Matilda Centre for Research in Mental Health and Substance Abuse at the University of Sydney. So thank you. So this has been a really busy year for the Institute and indeed for all of us, and it's been, I know, a challenging one in the light of COVID, and I trust that all of you have been keeping as well and safe as possible over the past year. I think it's forced all of us to do things in different ways, and some of which probably we'll be able to preserve for the future, and others are about learning, and we'll be very glad to let go of. So here in Sydney, we're just finishing our lockdown, and I think all of us are really excited to sort of be rejoining the world. So with the papers that we sent around, we included, along with the agenda for this meeting, we included some brief highlights from our year and some of the things we've been doing ourselves for COVID. We anticipate that the annual report will be available soon, and we'll send that through to you once it's available, along with the financial statements. So just a little bit of housekeeping here. So look, really intend that this meeting be as interactive as possible. It's a little bit harder on Zoom, but I think we're all pretty practiced at this now. So if you want to ask a question or make a point, as I hope you will, then please use the chat function or raise your hand to flag if you've got a question or comment, and then Karen, who's our event coordinator, will enable your microphone so you can ask your comment. And I'm sorry, but I think probably everybody's seen that we are recording this colloquium. We're aware that not everybody can come, and also we're hoping to get lots of insights and suggestions that we'll want to make sure we keep a careful record of. So I hope that's okay with everybody, and perhaps let me know if it's not. Okay, so look, our goals for today are really, most importantly, I think, to provide an opportunity for discussion about future priorities. Like, you're all in different places, and what we would like to hear, I guess, is what you think might be important for the Sax Institute, what might be important for the Sax Forum, what you think might be important in public health and health services research and related policies more broadly. So for us, that's the most important part of the meeting, I think. But we also want to consider the draft member charter, which we've circulated, and to provide a very brief update on some new initiatives that I hope will be of particular interest to our members. So this is what we're planning. We've got a little bit behind, but perhaps not too far. And perhaps we could move now into talking about some of the priorities for the future. And it'd be great to hear from lots of you about what you'd like to see. What do you think is on the agenda? The national level, the international level, the local level. How can we engage with that? What are your personal priorities for your organisation? Now, it's a really tricky time for some universities, and helping us think about what we can do to be as supportive as possible would be really useful. So we posed a few questions. But before we get to them, I just want to remind people about the Sax Forum. So I think I'm really pleased to say that we have almost all of our members have participated in some of the Sax Forum activities this year. 51 of our member organisations have come along to some of the sessions. So the purpose of the forum is about sharing information and exchange, developing new collaborations, and strengthening public health and health services research and its impact. We've had some special initiatives this year around early and mid-career researchers, and they wanted to focus on how to use cohort data, co-production, and out of that work, there's an issue of public health research and practice under preparation. And we've also started a stream in talking to research funders and partners. We had a great session, I think, with Marta Somi from the Medical Research Future Fund, and I've been speaking with NH and MRC, and we'll announce some seminars with them, particularly on what they can do to strengthen research translation over the coming weeks. So it's getting started, but what else would you like to see us do as part of the forum? So next slide. Thanks, Amanda. So we posed a few questions just to get us started. So are there opportunities to strengthen the impact of research on policies, programs and health services as we go forward? What do you think should be some of the priorities for the Sax Forum in 2022? Are there issues emerging from research that you feel should be drawn to the attention of policymakers or service providers? And are there other ways that we could work with you to assist in achieving our shared goals? But don't feel limited to those questions. We're pretty much happy for you to tell us where you think there are opportunities or where you might like to strengthen work with us. So over to you, and just the chat function or a hand would sort of work well. I think Ian, you're still not here? Okay, hopefully he'll be there in a minute. So would anyone like to start us off? Henry, we've been having, yes, Henry Brodati, we've been having some discussions about opportunities offline. Henry, you're on mute. Karen, can we unmute Henry? Thank you.
Okay, can you hear me now?
Yeah, perfect, thank you.
Right. So, I mean, my area is aging, and particularly cognitive aging or aging and mental health. And clearly aging is a priority area in general. But I'd like to be more general in my comments. I think one of the difficulties is having health service research funded. I know it may sound great, having missed out on 2 grants, the last 2 NHMRC rounds that I put in. But it seems to me that service and health service research and public health research is disproportionately underfunded. And I don't know how we can rectify that. But when you're when the playing field is, I think, uneven, because the science sometimes is not as hard-nosed as perhaps some of the biological research that happens. That makes it difficult. And then if the money's not there, then people don't get attracted to that area. Also, health services research, I mean, it carries through into publications. Unless it's a major finding, it's very hard to get into mainstream journals, and it's difficult to influence it. A third thing I'd like to say is that we've been having quarterly meetings with the Department of Health, the people looking after dementia in that department. And it's been fabulous. It's been good for them, I think. They've appreciated the opportunity to interact with researchers and know what some of the things happening on the ground are. And it's been really good for us knowing the changes that are occurring in policy. And if I can tell you one good news story, is that we did a project in 1985 to 87, which was doing a training course for carers of people with dementia. And we were successful, and we had it published in the BMJ, and we showed that it reduced carer stress, but importantly kept people at home longer. And we also showed that it had over 7 years, had a 5-fold decrease rate of institutionalization, and it was very cost effective. And then about 3 years ago, we repeated the training program, but this time for people with dementia and their carer as a part of a respite care program. So that instead of the person with dementia going in for respite care, so let's say for a week, they came in with their usually spouse, and there was a training program for the carer and for the person with dementia. And we showed against the comparison group that it had a lower rate of nursing home admission, institutionalisation. And then a separate group from Flinders actually did some cost-benefit analysis of it. And I forget the numbers, but the savings were such an order, there'd be millions of dollars saved if this was introduced around Australia. And then in the budget in May, there was $31 million for a respite and care training program. So it's possible to do.
Yeah.
And I think partly it was because we were able to tell the policymakers about this research and about the independent cost-benefit analysis that occurred. So having that dialogue, I think, is a really important issue.
So thanks to Henry for that, and I'm sure that other people will be interested in, and particularly well, it's a great story, but also that the shortage of funding and the difficulty of getting health services research funded. So now somebody has their hand up, but I can't see who it is. Karen, can you unmute the person who has their hand up? Oh. Oh.
I have got my hand up, but I don't know if you can hear me or if I've been unmuted.
Jane, thank you.
Oh, hi, Sally. Nice
Hello,
to see
Jane.
you.
How are you? Are you
Sorry,
enjoying
I should put
freedom?
my camera on as well. I can't do everything at once.
Yeah,
I thought I'd just follow up what Henry had said, because I think the challenge for health services research and health systems research is as great as ever.
Yeah.
And in getting it funded, but in many ways the challenge or the need for it is greater than ever. I mean, if we look at the National Health Reform Agreement, if we look at the recommendations of the Medicare Benefits Schedule Review, if we look at the intergenerational report, the issues around the cost of the health system and making it work more efficiently, while at the same time improving the equity, particularly equity of access to services, are really great. And I think there's a real danger in the next generation because we've had so much government spending and incurring of government debt as a response to the COVID issues. There'll be a great temptation there to pull back on public programs, such as our health system, to try and meet that debt. So I think that challenge is as big as it ever was in terms of getting the funding, and bigger than it ever was in terms of dealing with the challenges in the future. If I could add a couple of comments to what Henry said, I am really concerned about our early and mid-career researchers, because the support for them is low. A lot of them have lost their jobs, and those that haven't are still dealing with the uncertainty of whether they will have continuing employment. And the funding agencies have this view of what I call the sort of Uberization of the research workforce, that you can just pull a few people in when you want them, employ them on minimum wages for a few hours, and then send them off to fend for themselves. So I think being able to change that mindset to establish support and career paths for these people is desperately important, or we won't have a health services research, it's, population health systems research workforce in 10 years' time. And if I could add one issue that I think is should be seen as a priority, I think it's going to be the interplay between aged care services and healthcare services, and how they fit together in a way that is seamless and efficient, but equally getting the incentives right. So if an elderly frail person goes from residential aged care to a hospital, they're funded in one way. If the residential aged care service keeps them in place to take care of them, and I'm not saying they should do that if they need to be in hospital, but there's an area where there's substitutability, and therefore understanding that and the incentives that drive it, and making sure we can provide quality care wherever it is, without incentives driving inappropriate use of whatever it might be. So there you are. There's a contribution from me, and I should probably shut up now.
All fantastic points, Jane, and it seems to me from listening so far that the issue of funding for health services research is definitely something we could take on through the Sax Forum somehow. And the issue about aged care is going to be so important. Look, I'm deeply pleased that Ian is now online. So if I could hand over the chairing, Ian, we've just started on the discussion about the priorities for the future.
Well, thank you, Sally. I've just fallen victim to something or other. That's I'm actually doing this on my iPhone because I think nothing else will work. So I get very small images, but we are looking for priorities for the future, and I think that caught the most of the economic comment. I think if we look at overseas and so on, we've got sort of mass resignation, so there are workforce issues, there are supply chain issues into the health system. We've already got some drug shortages that are being dealt with. I think a Prepident was the last one in terms of cancer, anti-emesis and so on. So all of those things have to be factored in as there is increasing pressure on the health system as the states open up. So the question for the Sax is what sort of questions do you think perhaps we should prioritise for the future, but more broad than the economic ones only, but what about other things? Now, I think Dimity Pond, do you have a comment?
Yes, I do. Thank you.
Thank you.
So Dimity Pond, I'm Honorary Professor of General Practice from the University of Newcastle, having just taken a redundancy like 6 of my Professor of General Practice colleagues in the last 12 months. I wanted to talk about the interface between public health and primary health care. Obviously, I'm a GP, so I'm primary health care, but we are actually collecting vast amounts of data through our primary health networks around, which are really, really public health data around all sorts of our activities in primary health care, for example, for example, collecting data about smoking, alcohol. I've been working on collecting data about dementia, as Henry is aware, but that's very challenging. And there's a process of quality improvement through the primary health networks all over Australia, focusing on different topics. And my concern is that really there needs to be some more rigour brought into that. And I think the Sax Institute could well be involved in looking at those, the big data sets involved. How should they be handled? I'm concerned that the data isn't actually very good at the practice level, and possibly out of date, etc. How could we improve the quality and how to make sense of it? Because I don't know that government has, got their heads around how to make sense of all this huge amounts of data that's coming through.
That's a very, very interesting. Where's it housed, this data?
Well, primary health networks, there are around about 38 throughout Australia. They collect it automatically from our from our databases with agreement of the practices, and then it's sent to the Commonwealth. And don't ask me where it is in the Commonwealth. I don't know.
Well, that's one of the issues, of course, is, data that's collected and never used. So I think it would be worth exploring that and see if we can offer some facilitation of being able to use or link to that data, because I think there are a lot of examples around state and federal governments of data collections that may be well useful if they could be accessed. So I think that's a very good point. Thanks for that. Other issues that you think we're going to, or we perhaps should address in terms of either providing information to service providers or policy makers? Well, the other issue I'd like to have some comments on is what we've been running the Sax forums, which Sally has outlined to you as part of our wish to engage more meaningfully and more broadly with our members. And I just wonder whether there are specific topics that you would like to see covered in Sax forums in the next 12 months during 2022, because we can drill down on issues if we know what the members want. Now, I can't. I've got a message that someone's raised their hand. I can't see who it is. So whoever it is, if you go ahead.
Seems to be Michael Lambert and Chris Paul.
Thank you. So, Michael?
Wait a sec, Michael. Karen, can you demute?
Yeah, Michael, you should be able to unmute yourself now.
Yes, I can. I'd just like to follow on from the comments of the previous speaker who was talking about primary care. I think a very important issue, which I'm involved with professionally in my role as Administrator of the National Health Funding Reform funding pool, is the issue of avoidable and preventable hospitalisation. This is where people present at hospitals that if they had been given in the primary care, community care, adequate treatment as per the guidelines, they would not have needed to present in the first place. Now, approximately, I'm using the latest data from the Australian Institute of Health Welfare, that broadly speaking, there's about 750,000 preventable hospitalisations occur nationally each year. They're basically, the 5 ones that actually are the big ones are in the area of heart failure, chronic obstructive pulmonary disease, diabetes, cellulitis, and kidney and urinary tract infections. Those are the ones alone account for 330,000 hospitalisations, involving 1.6 million bed days and over $2 million of health hospital expenditure, which could have been avoided. That's just 5 of the conditions. So what needs is much more effective interaction between primary care and secondary hospital care, and a much more rigorous approach to the application of guidelines. Each of those 5 conditions I mentioned have in place good practice clinical guidelines, but the evidence is those are generally not practiced, not utilised fully in the primary care sector. So I think trying to improve the interface between primary and secondary, and trying to improve preventive health or appropriate early warning health in the primary care sector, it seems to me to be a very important issue. Thank you.
Thanks, Michael. They're quite astounding figures in a way in terms of monitoring and managing chronic illness. Any response to that before we move on? Because it's obviously a very important issue. Well, if not, I see Christine, you have your hand up. So.
Thanks, Ian. Hello, everyone. I just wanted to pick up on some of the workforce-related things that were mentioned earlier about early career researchers, particularly around them not having jobs to go to or career paths, and a need for more researchers or research-interested people in health services, whether they be health departments or local health districts. I'm aware in my kind of research oversight hat of a lot of people who are interested in being more closely connected to health departments and health services and working in them, but the pathway to get there is not always obvious for students who are doing things like higher research degrees or postdocs thinking, where do I go now? And I wondered whether the focus on early and mid-career researchers could include something about those pathways. And I know my university and a number of others are also interested in the qualifications that they produce being more work ready and life ready, and then perhaps at the student level, the higher degree research student level, there are opportunities for connecting people into health departments and health services so that they take that kind of pathway. So I just want to raise that perhaps would be considered.
Right, thank you. Yeah, I mean, I think that's a very good point, and I guess the difficulty is that all the universities, which are the bulk of our members, are under pressure, and it's a matter of how they prioritise the fund or the realign funding that they have, given the I think fairly long-term lack of overseas students, particularly perhaps from China. So I think that's a very good point that we should put forward what we think the priorities should be. I feel somewhat guilty these days supervising HDR students because I'm not sure what they're going to do when they finish, but that needs to be resolved. Megan.
Yep.
Yes, thank you.
Okay, sorry, I was just wanting to respond to Michael's point before.
Yes, please.
Potentially preventable hospitalisations. We've actually done quite a large amount of work in that area in both regional and metropolitan hospitals. And the findings just show that it's actually incredibly complex. It's not just about primary care not following guidelines. In fact, our data did support a strong relationship between primary care following guidelines and whether or not people were admitted for a preventable hospitalisation. But there are also a lot of patient factors. There are also hospital factors. It's a very, very complex region, and it's not something that's easily addressed just by encouraging use of guidelines, which doesn't mean we shouldn't be encouraging use of guidelines. Of course we should. So I'd be happy to share those papers with you, Michael, and to have further discussions about that. I also want to make a separate point about the importance of addressing climate change and the impacts climate change is inevitably going to be having on our health and our health systems. I'm based in Lismore with the University Centre for Rural Health, and we've done a lot of work looking at the impacts of floods and major events on people's mental health. But I think there's a whole massive program of work that could be done, and what are the appropriate policy and service responses to what's coming at us at a very fast rate.
I think that's a very worthwhile point. Other comments? Is there any research that's being done by the members, perhaps, that needs to be highlighted to our policy makers or indeed our service providers? Anyone feel that the Sax could perhaps help in that way?
Yes, so Ian, it's Karen. So Deborah has her hand raised.
Deborah, yes. Yep, thank you. You're on mute still. You're still on mute, Deborah.
Right,
That's
thank
better.
you. Thank you. I'm Deborah O'Connor. I'm from the National Ageing Research Institute, NARI, in Melbourne. I just a couple of points I wanted to make, and I think certainly echo the points around the interface and integration between the health and aged care system. That's coming through really strongly. One of the reasons why we were really keen to join Sax was the strong emphasis on research translation, health implementation and impact measurement. And I think there's still a lot of need for some really strong leadership in that area and training and education. And I think Sax is in a really good position to be able to do more of that even and support that. But the couple of specific issues I think I wanted to mention, one was being in Melbourne, and obviously different states are doing different things around telehealth and are trying all sorts of different methods and pivoting their services, etc. I think there's a piece of work that would need to be done looking at the way that this has been responded to across the country and where some effective change has been made. I know there is quite a lot of work, but I'm not sure whether anyone's doing any sort of cross-state evaluation on and looking at the sort of systems in place and funding in place there. So that was one. And the other area was, I think, following on from one of the comments that was made around resilience. I was at a meeting earlier today where there was a lot of concern about the ongoing well-being, particularly of the health and aged care workforces post-COVID, and a sort of a long COVID syndrome around burnout and possibly, moral stress and even PTSD. I just thought there's possibly some either longitudinal or some data that work, or a stream of work in that area if you are going to look at resilience. I think just some of the comments I wanted to make. Thank you.
Thank you. I think that's worthwhile. There have been, as you know, papers on burnout from the early year, if you like, of COVID, and in the various groups, particularly nursing groups, have published about this. But I think following longitudinally, we've probably got in the health sector worse to come in 2022 than we've had to date. So I think that's a very good point. Megan, you had your hand up? No, it's just still up from last time. Okay. Any other comments? Look, if there aren't, I mean, we have a chance to comment later. I'll move on to the next issue, which I don't want to spend a lot of time on because I want to give Sally some time to talk about some new opportunities for engagement going forth into 2022. But I just wanted to briefly mention the draft member charter, which was circulated prior to the meeting. Now, what the Sax has been doing, we've revised our constitution, we're having a look at our board charter, and therefore we're having a look at the members charter, all in line with the different governance that's occurring to organisations such as ours, but also with a view to, as I mentioned before, broadening out and making more impact on the collaboration between the Sax and the members, and what opportunities we can help create in research. So we circulated the charter. It's still to go to the board at the next meeting, but if there anyone that does have comments now, we're happy to take them, or in fact you can we'll put up on the last slide some contacts that you can make with us if you have other comments you'd like to make on that charter. So does anyone want to comment on the draft member charter? I think it's fair to say that what it really does, it's a bit like the colloquium replacing an annual general meeting. There are certain things like that are not required anymore, but rather than the members' primary point of contact being, a couple of them on the board, we wanted to create the Sax Forum and other things so that the members could liaise with us in a whole group of other ways, and the Charter is meant to reflect that broadening out of our responsibilities to the members and vice versa. So if you have any comment, I'm happy to take them at this stage. You don't have to. People don't like reading legal documents usually, so that's fine. But we're working hard to try and modernise that sort of liaison, make it more meaningful. What I think we'll do now, because there may be some more chance for comment, is I'll hand over to Sally to just run through a few slides that talk to you about 4 new initiatives that we're particularly keen to work on with members. And then we might have some time for some brief comment before we close. So thank you, Sally. And before I do that, I'd like to say, having missed the introduction where it was pointed out that like everywhere else, the Sax had a challenging year this year. I'd like to take the opportunity of thanking the board and Sally and the staff for having the Sax in a position where it can still be highly functional and relevant into next year. I think things have been going very well, and things like rapid reviews of data have helped governments and so on. So I think their hard work during this time has kept us in a position where we can still influence the system, and probably certainly will need to in 2022. So Sally, over to you for the new opportunities.
Thanks, Ian. Thanks very much. And I think, and for those comments, it's been a very interesting year or two. And I think it has been, I'm sure, for everybody online, brought its own challenges and opportunities. So look, I did just want to highlight a few things that we're doing or planning for next year. And I just, I very much value your views on them. I think so far, just a fantastic set of suggestions about other ideas to take on board, and we'll write those up after the meeting and circulate them around to everybody and come back to you with how we propose to respond. I think they're all things that would be great to take forward. So just to say that we'll contact you more formally about these, but if any of them immediately go, yes, that's something I'd be interested in, don't hesitate to contact either myself or Amanda Dominello, whose name you would have seen and who's our members officers. So, one of the things that we've sort of struggled with over time, and which perhaps COVID might help us with a little bit, is that we are really keen to know what skills and expertise you have in your organisation. If we know about that, we can do a better job of connecting individual groups and organisations with opportunities in government when they come up, and also with opportunities for collaboration with like-minded people. So, and I think one of the things that I have found is that when I talk to members individually, that we are able to generate tailor-made opportunities for taking things forward, and it's much harder to do that in a group. So we're wondering whether people would be interested in doing a presentation to Sax Institute staff or the Sax Institute leadership team in an informal way, just about the kind of skills and interests that your organisation has, with a view to strengthening our understanding and building some future collaboration opportunities. So again, we'll contact you properly, but if people are interested in that, please let me know. Thank you. I just keep getting this flashback of, I don't know if anyone's seen those spoofs on Chris Whitty, the Chief Health Officer in the UK, or the head of the NHS. They're all about, next slide please. I think he does all of his media briefings by saying that. Each time I do it, I'm now feeling like I'm being a sort of a joke, so apologies. So the second thing we wanted to chat about, which is something that came out of the discussions we had last year with people about what they would like to see the Sax Forum do. One of the things that people identified was that could we think together about how to have a sort of agenda setting function. So, the Sax, we've done a lot of work around being responsive to government, but how about when there are exciting new ideas emerging from research, that we feel we should bring to the attention of government? Is there a way we can use our collective power to do that? And likewise, I think there was sort of Michael's point a little bit earlier on is about somewhere where we know there are many opportunities to improve service delivery. Can we highlight some of those where we know that evidence and service delivery are out of touch? So we'd like to test this idea of, as we're calling it, Sax Sonar. We try and put in place a process to identify some topical issues, and we are hoping that people in the Sax Forum would want to lead this work, and we would provide the background support. Would involve probably a roundtable with policymakers and perhaps some summaries of the work that's been undertaken. So I'm not sure, but there are some things that we talked about today I thought was very interested in. Jane's comment about this interface between health services and aged care, and maybe that's something that we might want to take up as a potential issue under Sax Sonar. So we'll send around an invitation about that and see if people are interested in putting forward ideas. Thanks, Amanda. The third thing is more something that we've been developing over the past year, and I guess it's something that we probably all of us have felt for a long time, about the difficulty in bringing about change. So I think I was really interested in Henry's comment right at the beginning about how he set up the group with the Department of Health where there's an opportunity for ongoing exchange, and we all know that that's a really important way of kind of creating and bringing change to bear by interaction. But we've been developing a sort of structured approach to addressing areas where there's a need for change because the evidence is very clear, and where the need is really to coordinate, stimulate and sustain change with many different stakeholders over a long period of time. So, one of the problems that we often have in this space is that it's not our main task as researchers, so we get started, but then unless there's somebody who carries it through and drives it forward, the sort of change train, if you like, kind of breaks down at a number of different barriers. I think when we think about Ian Fraser's work, for example, you can see how important he's been and all the way along that pathway, really from making the initial discoveries to seeing it sort of fully adopted into government policies. So this process is very much trial. We've run it with some people in Adelaide, and we'd love to have some other examples, maybe some partners to work with where you might feel that you have some evidence around an important issue where it will be useful to gather together people to try and drive a change process. Next, the last thing I just wanted to mention is the work we've been doing that I think was in the handout that we circulated around 45 and up. We had a sort of really unique opportunity this year to collect real-time data to inform policy decision making, and I just need to pay tribute to my colleagues, Martin McNamara and the people in the 45 and up team who developed and delivered this. But what we did essentially was we resurveyed about 32,000 participants around 5 times during the pandemic. So these are the same people resurveyed, essentially about you might want to correct me, but I think about every 6 weeks or so. And we were looking at a core of questions, but also some special questions that related to different stages of the pandemic development. And I think really from our perspective, one of the most important things is the high level of engagement we've had with government, not just the Department of Health, but also Treasury and Premier and Cabinet. So obviously these data are available, and at the moment, we've just been doing cross-sectional reports on them, but they're also, because they're 45 and up participants, they're all linked to the administrative data onto their previous records. So we could, for example, look at how about people who were in good mental health before the pandemic? Was their experience during the pandemic different to those who were in good or poor mental health? So I encourage you to get in contact with Martin if you feel like these data would be of relevance to your work, or you would like to chat to us perhaps about an opportunity for an early or mid-career researcher to exploit these data. I think they're very particularly good for early career researchers because publications can flow rapidly. So thanks, Ian. Those were just the 4 things that I just wanted to highlight to people, and also to mention this exciting opportunity with National Health and Medical Research Council to share our views about translation. So we'll be in touch about all of them, but in the meantime, any comments or other suggestions or feedback on these would be appreciated.
So I'm happy now to throw open comments on either those 4 or further comments on the ways ahead in the last few minutes that we have together. We hope this will be we expect this will be an annual event, but we are particularly keen to hear any reflections on Sally's 4 initiatives there. Is the sonar something that could be worthwhile, for example? Well, I'm actually happy to take any other comments you might have. I thank you for your participation in this and the very helpful suggestions made so far on what we should pursue. I think there'll be a lot of things that will unfold next year, but particularly the aged care is going to be an important one. And I think there'll be a lot of challenge. Everyone thought that 2020 was the bad year until it got to 2021. I think we're being pretty optimistic about 2022, but I think there'll be challenges that we need to meet in the opening up of things and in how the health system will operate and what sort of workforce issues there might be there. Look, if there are no further comments, I think it only leaves me to thank you all for participating. On the screen is a slide of our contact details, and any of us on the screen are happy to be contacted about ideas you may have coming out of this or new ideas for how the Sax can interact and help the members in their research efforts, how we could facilitate bringing members together, and through the forum, how we could drill down on various issues to explore in more detail to see if we can, again, bring groups of people together with common interests and trigger research that way. So that's how we see what we do. There's also, of course, 45 and up, and all sorts of things can still come from that. So I thank you for your participation. I apologise for my technical issues. I've discovered it's not easy chairing a meeting on a mobile phone, but I really appreciate you coming up. We look forward to collaborating with you in 2022. Thank you.
Thanks, Ian.